Hi, I'm Elizabeth Hess. I'm here with the administrator of the Champaign-Public Health District, Julie Pryde. Hi, Julie. Thanks for joining me today.
Hi, how are you doing?
I'm doing okay. I was encouraged that Illinois was going in the right direction with numbers, and now we are one of the 36 states that's going in the wrong direction. Let's start with our numbers here in Champaign County. Where are we with our COVID numbers today?
Well, currently we have 1,031 cumulative cases in our county, 131 active right now. So that's starting to get up there again. We have 5 people hospitalized and we've had 17 deaths. And you may have noticed that last week we had about 5 deaths in 5 days. Currently in Champaign County, there have been over 45,000 individuals tested. Our county has a 2.3% positivity rate, and our case rate for new cases right now is 48 out of 100,000 people. So that's kind of where we stand. But if you look on our website, you will notice that our region, which is called the Central Region, we're actually backsliding some. So we have too many hospitalizations going on right now, not enough hospital capacity where we should be for level 4. So, if we get a few of those indicators that are moving backwards into phase 3, then we will have to move back into phase 3. That's the point of having the regions, that each region can look at their own data and make decisions based on that. So unfortunately, ours are going in the wrong direction as an entire region. I need to remind people that that is all the way from Iowa to Indiana, right through the middle of the state. So there's a lot of counties in there, but we're, when we keep saying we're all in this together, we're not kidding. It's not just, Champaign County does things for Champaign County. Because again, our hospital catchment area, even though we have, 210 or more thousand people in Champaign County, the hospitals combined see about a catchment area of about 1.5 million people. So we have to be not only concerned about Champaign and Urbana, but also Champaign County and also the counties surrounding us.
Did we go into phase 4 too quickly? Are we not wearing our masks enough? Did too many people rush to the hot spots, or is it a combination of all of those?
Yeah, so we didn't really go into phase 4 too early in the sense that we met the metrics to do that. I think that what was probably not anticipated is that when we moved into phase 4, that people were going to just start assuming that something had changed with the virus. Either the virus is not as infective, or it's not as deadly, or it's not as, causing as much morbidity, or whatever that is. But that's just not the case. So I think when people heard that we could have groups of 50 now, some have interpreted that to mean that you can just randomly be around 50 people. What I have to keep stressing with everyone, every single time I speak, is that number one, the virus has not changed. The virus is still as infectious. It's still causing hospitalizations. It's still causing deaths. Also, the virus is unpredictable. And so sometimes it's based on someone's age, sometimes it isn't. There have been everyone from infants to, people over 100 dying from this virus around the country. I also need to stress that throughout this pandemic, and including now, nothing is going to replace masking and social distancing. So if you are meeting with anyone outside of your cohort, or i.e. your household, every single encounter you have with another person, and it doesn't matter if it's your family or your good friends or your coworkers, that does not matter. What matters is that anytime you have an interaction with another human being and you're within 6 feet of them and you're not masked, both of those are going to put you at risk for a potential infection. And again, I have to keep stressing that we don't know when we're infected, oftentimes, because we can transmit the virus 48 hours before we have symptoms. So that means that you have to approach every single encounter with any other human being as they're potentially infectious and you're potentially infectious. So do not get within 6 feet of anyone. Just because you can go to certain things that are open does not mean that you should be going to things that are open. And certainly you have to understand that every interaction does bring the possibility of infection.
Am I hearing this and reading this correctly, that 40% of COVID cases are transmitted by asymptomatic carriers? Am I understanding that to mean that almost half of the people getting cases didn't even know they were infected?
Well, I'm not exactly sure what that stat is. There's all kinds of things out there like that. I do know that people can, for 48 hours before you develop symptoms, so 48 hours when you have no symptoms and you have no idea that you're sick, if you're infected, you can be infecting other people with that. And some of the people are, super spreaders. So they don't know that they're sick, but they're having interaction after interaction with all kinds of different people. And that can cause a lot of problems. We're seeing lots of outbreaks at parties, at family gatherings, at bars, places like that. There's just no way to do it. There's just no way to do things like that safely. Anything that involves not remaining far enough away from people and not wearing masks, it's not going to be safe. It's just not safe.
The recommended face mask use for 8 hours for students and teachers in Unit 4 and Urbana 116. It's a great guideline. I don't know how realistic it is. There's no perfect solution. What is your advice as we head into a new school year?
There just is no good answer for this at all. Because schools are so complex, and you want, of course, the social emotional learning as well as the in-person learning and all the wraparound services that come with schools, and a lot of kids desperately need these. But again, it is literally like an experiment in the sense that we don't know long-term implications of this virus. We don't know. Really, we haven't had, luckily, a lot of kids together in a lot of situations to find out what would happen. We don't want anything to happen, certainly. But the other important thing is, even with masks, the one thing, and public health is working on guidance now to help get out to schools and school boards and parents and people that are interested in this and are concerned about it. But unless schools can keep, or workplaces for that matter, unless you can keep people 6 feet away from each other throughout the entire day, that includes everything from transportation to going into the classrooms to lunch, recess, resource classes, and even such things as emergency drills. They still have to have fire drills, they still have to have tornado drills. Unfortunately, and much to my horror, they have to have active shooter drills. Every single thing like this has got to be thought through, and they have to be able to keep kids 6 foot apart and masked. And anyone who's ever worked in a school or had kids or been to a school or attended school knows that this is going to represent tremendous challenges. It just is. Then there's a bunch of other circumstances, kids that require personal aids, for example. How is that going to work with them staying 6 foot apart? So there's a lot of stuff to think about and work through, but I just don't have a good answer. And I get asked nothing more. I get asked about nothing more probably than this lately, is questions about school. So I do like that the schools have come up with, at least 116 and Unit 4, I believe, have both come up with like a hybrid type of model, so that they're looking to see how they can reduce the number of kids in the school. But there have to be, special considerations taken towards staff working in the schools, towards the teachers, obviously, and there's just a million pieces that have to go together for this to work well.
Let's say we go back in August, and suddenly 3 kids and 2 teachers are diagnosed. What is the threshold or the magic number that gets schools to close again?
Well, that I don't exactly know, because typically the schools close with guidance from ISB, Illinois State Board of Education. Public health would close if there was any type of imminent health concern, but then they'll be working closely with us. But so here's the deal. In a school, I think every situation, like every classroom, is going to be looked at almost like its own little pod. So if there are 2 or more kids in there, that is a that is going to be an outbreak. We're going to have to look at the teachers. Are the teachers remaining with those kids through the entire time like they can in grade school? Or is this a teacher that's moving rooms? So every single case, even if it occurs in a school, every case has to be evaluated to see what the specific situations are, and then we make recommendations based upon that. So I can tell you that public health is going to have a case investigator designated to nothing except for K through 12 schools in Champaign County. We already have them for other situations. We'll have quite a few associated with the U of I. So we will have people who are really focused on those specific issues and trying to get contact with the schools as quick as possible. We're looking at going to 2 shifts and then possibly 3 shifts once the U of I gets in.
We haven't even hit flu season yet this year. That's coming up this fall. What makes coronavirus or COVID different from SARS and H1N1 that makes businesses shut down? Why are we being so careful shutting things down?
Well, SARS probably closed businesses as well. We just didn't happen to have it around here. That did not turn into a full-blown, pandemic. But SARS was very concerning as well. It just didn't do what this is doing. The difference between this and flu, for example, is that flu is a vaccine preventable illness. So, there are a lot of people with immunity to it. A lot of people have had flu. Even if it's a different strain, there's still some crossover there. But with this is a novel coronavirus. So it is doing things that are very unusual. It is a new virus. So we don't have any experience with it. We have no idea what may happen with long-term morbidity. So in other words, if I get sick now and I recover, what does that mean? Does that mean that I am on oxygen for the rest of my life, that I have lung scarring that may become progressive? Does it mean that I had to have an amputation, or that I now have circulatory issues or heart, lung, kidney damage? Because that's what they are seeing in some people. At the beginning of a pandemic like this, we're focusing mostly on mortality rather than morbidity, but we don't know. And going forward, what's going to happen, 10 years from now? Will this be something like a hepatitis, or, hepatitis C, or a Epstein-Barr virus, or HPV, that later on we find out that it has other long-term consequences just by being infected with it? The fact is, we don't know. Therefore, this is not something people should be taking lightly. It's not something that they should be, for God's sake, going to anything like a COVID party. That is insanity. They should not be doing that. And they should not be taking it lightly, just assuming that, oh, I'll get it and I'll probably be fine. You may die, or you may have some kind of long-term consequence, or you may have really, I keep talking about some of the cases that we've heard of where people end up on oxygen, or the double lung transplants, or the amputations, things like that. It's just not something that's worth taking a risk on.
Since we started talking about this, I know you talked about it a long time before the public did. Back in February, we all thought, okay, if once we get antibodies, we'll be fine. That means we'll be immune. Nurses are now, a couple of them, one in Colorado, one in Washington State, have gotten it twice. So that's no guarantee. Is that how I'm reading that as well?
That's correct. I keep saying this, but the science has not caught up with this virus yet. So there are viruses that you get and you have lifelong immunity to. And that's why vaccinations work so well for some of those. But there are other ones that you get it and you may have no immunity. You can get it again and again, or you may have short-term immunity for a year or even less. And there are other things where you get it the first time and you have a mild case of it, and you get the same and reinfected, and you have a much more devastating impact from it because it's the second time you got infected with it. We don't know yet. Everything we're banking on is the fact that if you are infected, that you will have immunity. But that's just wishful thinking right now, because we do not know. So again, there's so many reasons why people should be masking and social distancing and not risking getting this virus.
I'm glad you brought masking up again. The Decatur City Council is considering fining people for not wearing a mask in indoor public places.
Mhm.
Would you like to see that implemented here?
I would absolutely like to see that implemented here. I think that we have really pretty good compliance in Champaign-Urbana. When you go around, you see a lot of it, but when you go into stores and things, you are still seeing people not wearing masks when they go in there. Um, and the, that's putting their employees at risk. I keep saying this. It's unfair. I don't care what people's personal beliefs are on a mask. This is a public health measure. It's no different than any other type of public health message or measure that we do. It is not a political stance. There is nothing political about wearing a mask or not wearing a mask. It is a public health measure. That's like saying washing your hands is a political thing. That's just ridiculous. One doesn't want to emulate someone who is not following public health guidance. That doesn't make any sense. So I would like to see fines. I think that we have done a lot with education and trying to get some culture change. And we have mayors here who model the behavior. We have officials at the U of I. We have a lot of people modeling the behavior. A lot of input from the community. But I can tell you that I get a ton of responses or requests, I guess, from the community. Can't you do something about people not wearing masks in public? I wish I could, but certainly that may be something that we're going to have to go to, because people are acting like right now that there's less of a chance of getting infected. There's actually more of a chance of getting infected right now than there was several months ago, because we have more virus going around. So you're more likely to come in contact with someone that has it. So it's important that people do this. And unfortunately, if it has to be that we do something, with fines, then that may have to be what it is. But stores should not have to be forced to police something as simple as asking people to wear masks when they come in there. But that's where we are right now. So it may be that we have to do that.
Today, New Zealand announced that all of the restrictions are lifted, everything's open. What could we have done to emulate, using your word from a minute ago, other countries in order to have done this sooner?
Yeah, well, that's the really frustrating thing, is that we know what to do. We know what to do when we have a pandemic type of situation like this. We knew about it here at Champaign-Urbana Public Health District in January. We knew it was going to be a pandemic. That means that everyone else in public health knew that, including at the federal level. But you have to start acting. We needed to do things to make sure that we had information getting out there from the experts, guiding this along, and it has to be flexible, because with something this new, at the beginning there were no masks and people were trying to hoard up PPE and N95s and things like that. Well, we were trying to prevent that by telling people not to do that. But as stuff changes, you have to have someone out there, which is in any other situation is always the Centers for Disease Control, saying those things publicly. You cannot allow them to be hidden away and not getting their information out, because their information is life-saving. One of the big issues, I think, early on was just a lack of a national response. We could have prevented a lot of this by everyone basically shutting down, if you will, at the same time, and stopping travel and stopping, movement between places, and taking it, doing it that way. But anytime, unless you seal a place off, for example, though, they're going to constantly have cases coming in there. But what we saw, and especially with the lack of testing, we were flying blind for the first 3 months of this. We had no idea where the virus was as it was starting to spread. You only saw it when people were hospitalized. So it's certainly not a lost cause. There is still time to act, and for people and places to do the right things. But it's starting to get to the critical point of no return, that it's like, are we going to just have to shut everything down again? I certainly hope not. But if people don't start doing the very basic stuff that has to happen. There's no way we're going to get control of this.
I'm too nervous to return to the gym, but people who are returning to gyms, they're just taking your temperature as you go in. And if you're under a 99.6 threshold, then come on in. That's not really an accurate way to measure this virus, is it?
No, it isn't. And if taking someone's temperature is it's a measure, but the problem is if you take an Advil or a Tylenol or an aspirin or anything else, that's a fever reducing drug. You're going to thwart that. I certainly know from going to the gym that there were plenty of people who worked out when they were sick all the time. I never understood that. Nothing seems less appealing than working out when you when you have a respiratory illness to me. But there's nothing magical about it. Part of it is that you're asymptomatic 48 hours before you show symptoms, therefore you're still infectious. So you're not going to have a temperature then. You're not going to feel bad. So it's just one measure, but it's absolutely not foolproof, and if people are basing their behavior based on that, it's a false sense of security.
Last questions before I let you go, and I believe you've already gone over this, but it bears repeating. Are we any safer from the virus or with knowledge than we were in March, April, or May?
No, there's actually more virus out there spreading around, right now. And it's very clear we're seeing where it's happening, and we just have to keep stressing with people that you cannot get together. You cannot gather. It doesn't matter if it's a cookout with your family, if it is a holiday type of event, if it's some event that's going on in the community that we may not know about. None of that is safe. There are ways to make things safer, but in general, like I keep saying, anytime you have interaction with another human being, you are risking infection. You cannot get within 6 feet of people, and you cannot go in public without masking to and expect things to change, because they're not going to. People are responsible for their own behavior of keeping themselves well and other people. And I'm really, really getting tired of hearing people saying, a mask is a personal choice. No, a personal choice involves your own situation. Not wearing a mask during a pandemic is affecting public's health. It's affecting other people, and it's potentially putting other people at risk. So in that sense, it is absolutely should not be considered a personal choice. We live in a collective society, and people need to start acting like that, especially during these times.
Perfectly stated. Thank you so much. Jason Liggett, this is our 20th time being recorded by you. It only took 20 times for the three of us to match our outfits accidentally. Thank you for doing this. I want to thank Urbana Mayor Diane Marlin, as always, for letting us, and UPTV, letting us do these updates. Julie Pryde, Administrator of the Champaign-Urbana Public Health District. What would we do without you? Thank you so much.
And I just want to remind everyone that the pandemics end. I haven't been saying that as much, but pandemics do end. And that just remember, we're only, 7 months into this now, less than that if you consider from our first case. So people just keep hanging in there and doing what you have to do. And hopefully we will get through this together, but it will end. And thank you too.